Hey guys, this is Dr. Samir. I just want to thank you for joining me today. So today I'm excited to start our new series, and for the next couple of videos we'll be talking about inflammatory bowel disease, the good, the bad, and the ugly. Now a lot of people may be confused about what inflammatory bowel disease is, how it's different from other GI problems, how it may be related to other things that could be going on within your gut. You may be confused about whether you may have IBD or not. And some people may have a condition called Crohn's disease and ulcerative colitis. We'll be talking about the differences between all of these and how we know what one person has and how do we help diagnose them, treat them, and hopefully get them taken care of as well. So I'm really excited to talk about this topic. I have a lot of patients who come to see me who have these conditions or who may think that they may have these conditions, and we are trying to do what we can to get them in the right treatment plan to get them feeling better. So for the next couple of videos, we'll be focusing on this overview, and so we'll be talking about the differences between ulcerative colitis and Crohn's disease. We'll be talking about how do we diagnose IBD or inflammatory bowel disease. We'll talk about the treatment of IBD. We'll talk about some of the extra GI manifestations of IBD, and then lastly, we'll talk about some of the health maintenance that you may need to do if you have inflammatory bowel disease. So this video, we're going to be talking about the differences between ulcerative colitis and Crohn's disease. This is a very important thing to talk about because a lot of people are confused. And the treatment options can vary pretty dramatically depending if you have Crohn's disease or depending if you have ulcerative colitis, and the long-term treatment plan can change as well. The symptoms may be different as well, and the workup will be different for both these two conditions. So when we talk about IBD or inflammatory bowel disease just in general, it is considered an autoimmune condition, meaning there's something within the gut there's something within the body that's attacking the GI tract. We think it may be a combination of environment, genes, maybe even food. No one really knows the clear idea of why you're developing this autoimmune condition, but that's basically what it is. Your body's attacking the gut for any number of different reasons, and that can manifest in a lot of different ways. What we have in patients who have IBD is that they have inflammation of the mucosa of the GI tract, so we can actually see inflammation that's there. We can see it either on imaging or on the scopes that we do. We see ulcerations, inflammation, redness. It just ends up looking very tattered within the GI tract. That inflammation can lead to the symptoms that people complain about, whether it's bleeding, anemia, pain, or even, gosh forbid, worst case scenario, long-term untreated IBD has the potential of going to cancer as well. So we talk about the differences between UC and Crohn's. It's important to understand the distinction between the two because the diagnosis is different, the treatment is different, and the long-term complications are very different as well. So for ulcerative colitis, it only affects the colon, and that's it. It does not affect the small intestine, does not affect the stomach, does not affect the mouth. It's only the colon that's involved, and typically the rectum will be involved as well when you have ulcerative colitis. On the colonoscopy that we do, and that's how we help to diagnose ulcerative colitis, we'll see continuous inflammation throughout the colon. And in my mind, and this may not necessarily be true, but when you compare the two, the long-term treatment plans and possible prognosis for UC tends to be better. It's not as aggressive as Crohn's disease, and it is a little bit more easier to treat than Crohn's disease. Now, talking about Crohn's disease, in Crohn's disease, it can affect anywhere within the GI tract. It can skip different areas. So you can have it affecting only the colon. You can have it affecting only in the small intestine. You can have it affecting only in the stomach, or even any combination of anywhere else within the GI tract. Crohn's can go wherever it wants. Typically, the rectum will be spared in Crohn's disease as well. And like I mentioned before, you'll have these, it can occur anywhere within the gut. I tend to think of Crohn's disease as a more difficult disease to treat. There's a lot more inflammation that's occurring. It can occur in multiple different areas, and so we kind of think of this as a more aggressive type of inflammatory bowel disease than when compared to ulcerative colitis. So let's focus on ulcerative colitis right now. So this is the most common inflammatory bowel disease worldwide. It's the disease of the mucosa alone, and because of that, you tend to have less complications as well. Now, ulcerative colitis is curable, and the only way you can cure that is removing your colon. Once you remove the colon, the disease is gone, and you don't have any more inflammation that's there. And smoking for some patients actually can be protective in ulcerative colitis. Now, with this, I'm not saying you should smoke to treat your UC at all, by no stretch of the imagination, but there is evidence suggests that smoking can be protective in some patients with ulcerative colitis, and we found that for some people who stop smoking, that can lead to some worsening symptoms in some patients. The main symptoms for ulcerative colitis is really bloody diarrhea, with or without mucus that's there. And this is why we recommend evaluating anybody who has rectal bleeding, because that can be due to any number of different reasons, and one of the reasons you can have is ulcerative colitis. So typically in this case, you'll have more loose stools or bloody diarrhea. You can also have what's called tenesmus, or the urgency to use the restroom but not being able to go, and also systemic symptoms including fever, pain, joint pain, just not feeling well, weight loss, and things like that. Now, when we take a look in the colonoscopy, you'll see continuous inflammation within the colon. This is an example of a patient who I diagnosed with ulcerative colitis. You see this inflammation seen within the gut, and it tends to be a continuous inflammation that's there. Now, the important distinction with ulcerative colitis versus Crohn's disease is that you don't have any perianal complications. So you don't have any perianal fistulas, nor do you have any perianal abscess. In fact, if you have somebody who has a fistula or an abscess, we typically think it may be Crohn's disease and not ulcerative colitis that's causing that. And so with UC or ulcerative colitis, you will not have any perianal complications or abscess, but you will have other complications that can occur with ulcerative colitis, and this includes things like bleeding. So bleeding can be very common, and in 10% of the patients, it can lead to severe iron deficiency anemia. In fact, I saw a patient today who came to see me who had a new diagnosis of ulcerative colitis, whose blood count dropped down to extremely low levels, and this can be a very common manifestation of ulcerative colitis. Also, you can have what's called toxic or fulminant colitis, which is where you have severe, extensive colitis in the colon. This is a severe disease that can lead to significant complications, including the risk of causing a tear within the colon. This is usually in those patients who have very severe ulcerative colitis that is not responding to medical options. This can lead to what's called toxic megacolon, which is where you have severe colon distension. Your colon gets very, very big, greater than 6 centimeters. You have systemic symptoms including pain, nausea, upset stomach, and there's a very high risk of significant complications with toxic megacolon, including perforating the colon and causing a tear within the colon. Stricture formation is very uncommon in ulcerative colitis, and typically we can see this in Crohn's, but not in ulcerative colitis. But if we do see a stricture, we are concerned that stricture may be cancerous in nature, so that's one thing we have to keep an eye out on. It's not common, but if it's there, that's something that we do worry about. And lastly, there is a risk of developing colon cancer, especially with long-term or long duration of disease with ulcerative colitis. The longer you have the disease, the more high risk you are for developing colon cancer, which is why for those patients who have long-standing disease, we would have to keep a closer eye on them with more frequent colonoscopies. So that's ulcerative colitis in a nutshell. Now we're going to move on to Crohn's disease. Like I mentioned before, Crohn's disease tends to be a little bit more of an aggressive type of inflammatory bowel disease compared to ulcerative colitis. So it's less common than UC, but it has more inflammation. In fact, you have what's called transmural inflammation, in which inflammation goes throughout the whole entire mucosa of the GI tract. It's not limited to the surface like ulcerative colitis is. It goes all throughout the whole GI tract. So initially, ulcerative colitis will present as inflammation, severe inflammation, and that inflammation can lead to either stricture formation or it can be penetrating disease leading to abscesses and fistulas as well. Also, Crohn's disease, unfortunately, is not curable. So once you've had Crohn's disease, we do have to put you on treatment to get that taken care of for you, unlike ulcerative colitis, which can be cured with removing your colon. And smoking for Crohn's disease does make the disease worse. And what we found is that those people who smoke tend to have a higher chance of having complications from Crohn's disease, and those people who smoke have a more difficult disease to treat. And so one of the things that we do for our patients who have Crohn's disease is to encourage as much as we can for them to stop smoking. Now, the symptoms for Crohn's disease really depends on location, location, location. If you have Crohn's disease in the small intestine, that will present differently as Crohn's disease within the stomach, which present differently as Crohn's disease within the colon. But the most common presentation is watery diarrhea. And a lot of people have complaints of diarrhea, and this is one of the things that we look for when we have somebody who has Crohn's disease. They also may also have some cramping and some weight loss as well. But the key thing with Crohn's disease is that you can have perianal disease, meaning you can have fistulas, abscesses, strictures, and even large skin tags, which is very different from ulcerative colitis. With Crohn's disease, you have very rare rectal involvement, but you do have perianal complications, like I mentioned before, mainly fistulas and abscesses. So somebody who has a fistula or an abscess, we're thinking more on the lines of Crohn's disease than ulcerative colitis. Now, like I mentioned before, Crohn's disease can present anywhere within the gut. The most common location is between the ileum and the colon, and that's why we end up doing a colonoscopy to see exactly if there's inflammation that's there. About 30% of our patients have only small intestinal disease only, which is why when we take a look with the scope, we don't see anything. We recommend further evaluation to see if there's any small intestinal causes for your symptoms. About a fourth of our patients have perianal complications, and about 20% of our patients have only colonic disease from Crohn's disease, and about 15% of our patients have disease within the small intestine or within the stomach. But the most common presentation is ileocolonic. Now, like UC, there are complications associated with Crohn's disease. One of them is obviously the fistula, like I mentioned before. This is a connection between two different organs, mainly it could be the bladder and the colon. It could be the colon and the colon in two different parts. It could be the colon and the small intestine. But this is a connection between two different organs, and it's very common within the perianal area to have these fistula. You develop an abscess as well. This is when the fistula actually becomes infected, and you have this big ball of infection that's within the GI tract or outside. This is very common within the perianal area as well. You can develop strictures. It tends to be more within the small intestine than anywhere else, and this can lead to symptoms of pain, nausea, upset stomach, and weight loss. Now, the strictures in Crohn's disease typically are not cancerous, or we're not concerned about cancer, as opposed to ulcerative colitis, in which the strictures that we find in the colon are worrisome for possible cancer being there. And lastly, also you have the risk of developing cancer for long-standing disease for people who have long-standing Crohn's, especially within the colon. So in summary, the main difference is, keep in mind, ulcerative colitis is only within the colon. It tends to be continuous inflammation in the colon, and most people present with bloody diarrhea. This is very different from Crohn's disease, which it can be anywhere within the GI tract: stomach, small intestine, colon, rectum, or even any combination of anything. It tends to have what's called skip lesions, so you don't see any continuous inflammation that's there. And in terms of the prognosis, Crohn's disease tends to be a little bit more aggressive, which means that the prognosis can be a little bit more difficult to treat, and the workup and the diagnosis can be a little bit more difficult as well.